Yeah. Or you can actually show it in the chat. But it's 7:02. I am just waiting for, let's go wait for a couple of minutes and see whether we can have the other people log in. But thank you so much for coming in and joining me on my second workshop. I am just really looking forward to telling you all about strength training and understanding basically, is it okay to lift? So that's why the title of the workshop is to lift or not to lift, right? That's the question. And it's really focusing on, different facets and aspects of not just identifying, is it safe for you to lift even after a diagnosis of osteoporosis, but it's really overall training when it comes to how do I get started? How do I know my baseline? So this is more like an interactive conversation. So let me just 7:03. We're gonna go ahead and get started at 7:05. But while we're doing that, because I feel it's just too quiet, let me just check the settings if I can have everybody's mic and camera, or just the microphone, just in case if I ask questions. All right, let me just. There we go. I think I did the settings. Just FYI, I think when you joined in, you were informed that this workshop is recorded. So if wanted to go back and if you basically missed any information, I usually would let you guys know, like the link, and I'll pick up and I'll post it on YouTube. So if you missed the first one, there is a YouTube link, or if you want me to share the YouTube link, let me know. Okay. But all this information is basically on our website at www.forlifehealthcare.com. All right. So one more minute. Yep. People are texting me. Everybody's on mute. I change the So you are actually allowed to unmute yourselves.
Oh, hello.
Hi.
I'm unmuted. It's allowed.
Yeah,
And
hi.
now, oh, now I can see in the camera too. Oh,
Okay.
because
So
you had us on no seeing and no hearing.
yes. And the reason is because I want to protect your privacy. So if you guys are okay to be on camera, you would want to be on mute. So that's, one of the reasons, because like I said, again, this workshop will be posted on YouTube for everybody's, benefit, so that's why I want to make sure that you guys are okay. That's why I started off with not allowing camera and, being on mute, just to give you a heads up that, our conversation is recorded. All right. So you can keep, your camera to be on, to be closed and to be on mute. That is
Let
perfectly
me just
fine.
fix my hair a little bit. I'm good.
How is
It's okay.
everybody doing? So, for those who just actually joined in, my name is LJ Brooks Estrada. I am a physical therapist. I've been a physical therapist for more than 24 years. And I'm happy to say that I actually just started, my own business. And part of it is really, engaging the community on how we can be better each day. So that's kind of like one of the reasons why I wake up, first thing in the morning, is how can I make things better, not just for me, but for the people around me. So, and that's one of the purpose, of this workshop. And I'm really looking forward to sharing that, with you. So this is basically more of I want for you guys to understand what is it, why is it important for you to understand strength training, right? Because a lot of people has, different perception about strength. And then we are going to do a couple of fitness tests. So we're going to do jumping jacks. We're going to do arm wrestling. No, I'm just kidding. So we're not doing that today, but maybe tomorrow. But for today, it's going to be, trying to explain to you the overview about strength training and what are the safe movements that you guys can do to get started. Okay. All right. So I hope everybody's ready. I'm going to go ahead and share my. I actually want to give a shout out to my mother-in-law, Miss Mrs. Brooks, for trade, because I had some technical difficulties when I was starting, and I'm like, how am I going to get? And I kind of figured how I'm going to do it without. Okay. Can everybody see the presentation?
Yes.
Yes. All right, perfect. So to
Yes.
lift, thank you. To lift or not to lift. So it's one of those basic questions whether lifting is basically a sign of intensity, it's a best sign of strength. But I'm going to go ahead and talk to you about our agenda. So first thing, what's the benefits of exercise, right? So that's one of the reasons why we would want to do strength training, and that is what does it do to us if we do strength training. We're also going to do some fitness assessment here. It's already lined up. We're going to do three of the fab four, and that's one leg standing. I can see eyebrows raising, squats, which is the 30-second sit to stand. And then we're also going to do 2 minute step test, which is if anybody can do a jumping jack, then we can definitely do some jumping jacks. But 2 minute step test is one of those fitness assessment. The other thing that we're going to do is what are the strength training recommendations, high impact versus low impact, intensity progressions. So it's those are like the information that we're gonna talk about. And then finally, what are the red flags, like how do you know when to stop, and understand that everybody is different, but like I said, this is more like an overview for an average person. Okay, and then of course at the end we're always going to do a Q&A. And then if you have any topic, I already have a topic in mind that I actually want to talk about next month. But like I said, where it's free for all. If you guys have any specific topic that you would want me to touch base on and you would want me to focus on, I'm more than happy to, to talk about it. All right. So let's get started. So, what is the benefit of exercise? There is a campaign by healthcare.gov called Move Your Way. Is anybody familiar with Move Your Way campaign from the government?
Yeah, it has something to do with Obama's wife.
Yes. So, Move Your Way. So basically there is a link, in our tool. So when you go through this, this is what that website looks like. So the great thing about this Move Your Way, it gives you an activity planner. It will, provide you how much activity are you supposed to be doing, pretty much 150 minutes a week. And then the other thing is you're supposed to do at least 2 days a week of exercise. And it's not really, they didn't really mention exercise. They're actually more on activities. Like what activities can you consider and, integrate in your daily task. So that's kind of like the whole program, the Move Your Way. And every part there is an aspect for kids. There's one for, pregnant, during if you're expecting, if you're specific, specific age, if you have any issues with with any pain. So that's basically that healthcare.gov initiative. But one of the key things, and the reason why I mentioned it is because Move Your Way has a lot to do with the benefits of exercises based on their study. So these are all government research. So the first thing is it boosts your mood. It actually improves your, they did several studies about how, like whenever you exercise, you actually, it improves your circulation. It improved, like the release of, happy hormones. So they definitely, it does boost your mood or improve your mood. The other one is it sharpens your focus. So, one of the key things about sharpening your focus, they did a study about how exercise impacts patients with dementia. And one of the widespread, study about does it basically improve, you know, your memory. Based what it does is, since you have to remember your brain is a highly vascular, you know part of your body. So obviously when you improve your circulation, when you which is
Vascular, vascular. Let's have a definition.
vascular blood vessel,
Okay.
there is high it's highly vascular, so there is a lot of blood vessel, going through, your brain. So a lot of connections. So definitely if you're exercising, and then they did it, like I said, they did a study about, with dementia patients. They found out that exercise, is one of those proven activities, like physical activity, that can actually improve and slow down your memory loss. So if you want to talk about that, I can always send, the information about it. And then, of course, reduce your stress, right? So you always have to identify. That's why a lot of times when we look at the benefits of exercise, because when we look at exercise, everybody has a different definition. But at the end of the day, it's all about how are you keeping yourself active, right? So we have, just like, for me, for example, like just walking around the house, right, Miss D, Miss EC,
Yeah,
walking
no,
around the
no,
house.
no, no, no. I think yours needs to be much more than that. Mine can be walking around the house. Yours needs to be dumping jacks, push ups, stuff like that.
Yes. So push-ups, or, walk for me, walking around the neighborhood, basically it's, and again, it's just trying, you have to choose your own level of activity. That's why, like I said, this is the benefits, knowing how to know your baseline and understanding more about how do I know whether whatever exercise I choose will be safe. That is the general part of, the discussion that we're going to have today. So the other part is, of course, when you have improved mood, you have sharpened focus, you have reduced stress level. Guess what? Your sleep is also affected. You will have improved sleep, and one of the reason is because, again, it's all about that improved circulation that you have in your body, and understanding that of all of those, because a lot of times, whenever I ask, my patients, or anybody, one of the first questions that I ask is, how much sleep are you getting? And the reason why I always ask that question is because they say, how when you sleep everything shuts down, now your body is really more focused on recovery. So imagine if you're only getting 2 hours of sleep or 3 hours of sleep, right? So what do you think is going to happen to your recovery? It will slow down, right? That's why it's very important. Those are like one of those, low hanging fruits that you can definitely, look into. Understanding your sleep hygiene, understanding like if you are constantly waking up every 2 hours. And I totally understand that every person is different. So, like I said, I have a patient where, she said, I can only sleep 2 hours because I have to go to the bathroom every 2 hours. But for me, like I said, let's try to find a way that we can kind of increase that number of hours. So I never said it's easy, but at least you are aware that, sleep is very, very important. Okay. All right. So we're gonna go to the next one, and that is the everybody's excited about this fitness test. So if you are able, okay, that's why one of the things that we can do, I'm gonna go ahead and demo, and I'm going to explain to you the importance of every aspect and what it is, why is it considered a test. So it can be both a test and an exercise at the same time. Okay. But one leg standing tests basically your balance and your strength. They did another, and one of the reasons why it's on top is because they did two things. They did a study on two tests for the lower body strength and then the upper body strength. For the upper body strength, it's grip strength, those dynamometers, but we don't have a dynamometer, so we're not doing that test. For the lower body, it's actually one leg standing. And the reason why that's important is because, again, the ability for you to stand, and it's not for the whole 1 minute. We're just asking normal is considered 30 seconds. Okay. So 30 seconds of standing on one leg without holding on to anything. But
Okay.
like I said, if you cannot do it, so you're not there yet, right? So I'm going to talk about the, modifications and the things that you can do. The other thing is squats. So squats is equivalent to standing up, sitting and then standing up. Your 30-second sit to stand. So we will count how many are you able to do, how many squats can you do or sit to stand you can do in 30 seconds. Okay. And then cardiovascular strength has a lot to do with your 2 minute step test. So it's more like basically marching in place, right? So that, and then if, like what you guys said, if you're capable of doing jumping jacks, then definitely we can do some jumping jacks. All right. So one leg standing, is anybody joining me doing this this test?
No, and we can't see you.
Okay. Oh yeah, you can't see me. Wait a minute. So let's stop sharing. And but you can see me on that little thing, right?
No,
Yeah,
that's
I can see you. This is Bonnie Barella. I can see you,
oh, you
LJ.
can? I can't see her.
Yes. Oh, I can't. I
Hi, Miss
can.
Bonnie.
Hi,
How are you?
LJ.
Okay. Alrighty. So with if anybody can see me, so one leg standing, why is it an essential? Like I said, when they did a study about the test, grip strength and one leg standing are the two tests that they've identified that would determine, like for one leg standing, to determine the strength and balance of your legs. For the upper body, it's actually your grip strength. So one leg standing, like I said, we don't want to complicate things. So if you guys can see me, so yeah, I'm using this chair. So you can go ahead and start. If you have a counter, right? You have a chair, and then what you're going to do is, obviously, if you're going to test the right leg, all you have to do is just lift your left leg and you're testing the right leg. Okay. And then you let go and then you hold it. Yeah, see, I'm shaking. You're going to hold it for about 30 seconds. All right. So that is a good test of both balance and strength, right? So one of the key things that you have to do is, if you start feeling like, well, LJ, I can't do that. I cannot do that yet, right? I do have patients where they are unable to actually even put weight on that leg, and sometimes one leg is stronger than the other. That happens. So I always tell anybody that I meet that the more you know about yourself, the better that you can handle your own fitness goal or your own activity goal, right? So if you can't do it, then it means, oh, then probably we have to strengthen those legs, right? So the first thing is, if you're holding and then you let go, right? Obviously, now you're shaking. If you start feeling like, well, I'm not holding, but this is how you're moving, then it's not really balanced, right? Because you're supposed to stack yourself against, your own body. If you can't do that, then you have to start training yourself. So how do you train? Doing the exact same thing, except you can hold on to something. If you feel like, LJ, one hand is not enough, I need to use two hands, guess what? You can, right? So the component of balance was removed from your one leg standing because you're holding on using both of your hands. And then how do you progress? Right? You guessed it. You actually just let go of one hand, and then sometimes even just one finger touching a surface, right? And then eventually you let go. So that is kind of, if you can't do it, at one time, you definitely have the ability to do it. Like I said, at the end, we will talk about if that exercise is even the right one for you, especially if it's causing you pain to even do it, right? So, like I said, if it's possible, if you are able, then these are the fitness tests that you can actually do. Okay. What about your squats? So, squats. So, have you ever heard of the term Asian squats? Right? So, Asian squat. So, squat is basically, oh, by the way, I'm Asian. So when you squat, can you guys see me all the way down?
Yes.
That is a deep squat. But when you talk about sit to stand, all we're asking for is if you have a chair, right? Let me go sideways. If you have a chair, which is average chair height from the floor is about 18 inches. So yeah, if you have an average chair like this chair, so all you have to do is, stand up, right? And for 30 seconds, you can set up your timer and see like how many sit to stand can you do. So those are your squats, right? So I feel like LJ, I can't do that. It hurts my knees because squat is really very dependent, on how much it's a combination of movements. You're not just bending your knee, you have to bend your hip. And obviously you saw me bending I'm hip hinging. So those are the things that you have to, take note whenever you're performing such exercise, right? And then of course that the next one is your 2-minute step test. So the 2-minute step test is really more for cardiovascular. So that's very important because you're continuously doing the same movement. And 2-minute step test, two things. If you cannot, basically, you don't have a box, you cannot go up and down, you definitely can just march in place. That's it. You see, I'm not holding on to anything. I'm marching in place. I'm not doing one leg standing, but I'm practically, lifting my leg off the floor, right? So that is your 2-minute step test. And then if you feel like that is too easy, LJ, the step test is just too easy, then guess what? You guys can also do a 2-minute jumping jack. All right. So you can always do this if you feel like, LJ, I think I can do it. But, if you want me to, you can take a video of it. Or if you want me to actually, do a FaceTime and look if you guys can, we can measure. I'm all for it. So I really want you guys to learn more about yourselves and, getting started with your fitness journey. Okay. All right. So let me share again my screen so you guys can see. There you go. Good. All right. Strength training recommendations. So we're now getting into the, sarcopenia development model. So when I saw this development model, I'm like, this is something I really, really want you guys to see. And by the way, all the presentation, you'll get a copy of the presentation. So is the link for the video on YouTube. Okay, so you guys can just look into it. So the reason why sarcopenia, does anybody is familiar with sarcopenia?
No, no.
No? Oh, okay. So not a problem. That's the reason why we're, we're having this conversation. So I am going to the next slide because that will give you a much more visual representation of what sarcopenia is. Because you already heard osteopenia, right, from the last conversation that is related to bone weakness. Sarcopenia is actually weakness of the muscle because the basic unit of a muscle is a sarcomere. So I don't want to be too scientific with you guys, but let me go ahead because I am a very visual learner. So, oh, sorry about that. Okay. Sarcopenia is loss of skeletal muscle mass. So obviously, you've seen bodybuilders, like they're beefing themselves up, right? So what happens is they did a study like how soon can we start experiencing sarcopenia. It doesn't take too long. Actually, at the age of 30, you're going to start losing skeletal muscle mass. So that's why if you look at this whole, it's all interconnected, frequent, if you're becoming much more of a fall risk, why you feel like you're a little bit, you're more tired than usual. That is because scientifically we do have, loss of skeletal muscle mass starting at the age of 30. But like I said, just like osteopenia, this is something that exercise and physical activity can actually, resolve, right? So we just really have to be mindful that everything that you see in this developmental model has an impact if you start exercising. Isn't that amazing? By just exercising, you're like resolving a lot of this, a lot of these concerns, right? So I'm just really excited that you guys are joining in. So I'm going to go back to the previous slide. All right. So after like, okay, LJ, I cannot do one leg standing. I cannot do sit to stand. Probably I can, but I can only do one repetition and that's it. Right. So it's always about learning more, learning about yourself. Right. So that's why I'm here to make you guys understand how do you establish a baseline, right? It's always good to know where you're at. After you've done the test, you're like, all right, I want to know where to get started. Okay. And everybody's different, is in a different stage in their journey. Okay. That's why 1RM, the name RM is actually known as repeat maximum. Okay. So when you hear, have you ever heard of 1RM life? Have you encountered the term 1RM life or how to
No.
prevent 1RM life? So
No.
picture this. Picture the situation where you can only do one thing. So one classic example is going up and down the steps, right? So some patients or some of my clients, they do everything. So they would go their bedroom is on the second floor and everything else is on the first floor. So what they do is they're in their their bedroom, they go downstairs and do everything and can only go up one time. So that's kind of one repeat maximum. They do everything on the first floor because once they go up to their second, their bedroom, they can never go down because they're just too tired, too weak, or they have pain. That's what is considered as a 1RM life because everything is based on your limitations,
Okay,
right?
I'm a 1RM life.
Yes, nobody wants a 1RM life. That's the reason why, we want to establish like what's your repeat maximum, right? It's your maximum load. So let's just say I'm going to go get a dumbbell real quick. Okay. So let's just say this is, how much is this? This is like 15 pounds, right? So let's just say this is 15 pounds. So 1RM has a lot to do with what your ability to lift or what load you can lift. So let's just say if I lift this right here and you see it's too heavy for me. You know why? Because when I lift, I started changing how my posture looks like. So it means 1RM is once you lift that amount of load, that's it. You cannot do another repetition. That is your repeat maximum, right? So what about your 10 RM? So you just have to check if I lift something, let's just say I'm lifting this water bottle, right? So it's the reverse. So if I'm lifting this water bottle, this is like probably 2 pounds, and I can probably do this like 50 repetitions and I'm not going to get tired. So it means if I was able to make, to 50, you know, to do 50 on that water bottle, that's 50 RM. So it means that, you know, the 2 pound is my 50 RM, right? So 10 RM is if you started lifting, because actually for those who's doing their exercises, most of the repetitions that your therapist would tell you to do is do 10 repetitions, 2 sets, right? And that is because you're supposed to, and that's how you know whether is the exercise I'm doing too light or is it, you know, too hard, right? So let's just say you're only able to do 5 and you're tired already. So it means that's not your 10 RM. It's your 5 RM, depending on how many repetitions you're doing. And it means like it's just, you know, you're already changing your posture, you're changing your form, right? Therefore, that is not the right intensity for you. So you always have to focus. It's not about intensity, it's about how how's your form, right? So you know how some people, if you go to the gym, some people are like they lift heavy, you know, they do a lot of heavy lifting, but then again, they're compromising their posture. They're using accessory muscles, right? So that is, you know, that's not worth it because obviously if you do that, that's too much, you know, load for you. You're going to probably injure yourself and you don't want that, right? So that is how you determine your 1 RM. So when you pick up a 5 pound dumbbell, right? And you're like, and that's one of the things that we're going to talk about intensity. So you pick up a 5 pound dumbbell, you know, you bought one, and then you started lifting. You're just activating your biceps, right? So you did this, and you reach about um, you know, about 15, and you're like, LJ, I feel like I can do more, and you were able to reach 20. So what that intensity means is that you are, you know, it's too light for you. The 5 pounds that you just did 20 repetition on, right, continuously, okay, it's too light for you. So what does that mean? So you're like, well, LJ, if it's too light for me, is that bad? In a sense, you're, it's like, you know, when you look at medication, you're underdosing yourself because you have to understand exercise is a prescription. That's why we tell you do 10 repetitions, 2 sets, right? So if you're underdosing yourself, then the thing that you're doing is you're basically um, maintaining your strength level. You're not really more of a progression in terms of strength training. Okay. So always remember that, you know, that is one of the way that you can establish your baseline. And then if you notice this, the set, like how many set, if you have 10 repetitions, the set is just do 10 repetitions for every exercise. All right. And then, sorry, the repetition, it's more like frequency. The frequency is about 2 to 3 weeks or 2 to 3 times per week. All right. So you have to have, and why is that important to understand? You know how sometimes you'll do exercise 2 consecutive days, and then the next day you're like really, really tired. So the goal is for you to have at least within 24 to 48 hours of rest if you are exercising the same group of muscles. So let's just say you know, you exercise your legs, and then this is more strength training, right? And then you have to have a rest day. You either work on your upper body if you worked on your lower body on a Monday. Tuesday, you can do cardiovascular or you can do upper body. And then Wednesday, you have your 24, 48 hour. Then go ahead, you can do legs again. All right. So those are your 2 to 3 weeks, you know, for your frequency. All right. So the other thing, where is, okay, intensity and progression. So this one, like I said, we always go with, you know, based on the study, and that is the recommendation of moderate to intensity aerobic activity, right? High intensity, moderate activity. So remember, we talked about the difference between high intensity, high impact versus low impact. Because you always hear these are low impact exercises, these are high impact exercises. So usually low impact exercises, those are not the ones. So if you're not jumping in place, you're not doing a lot of jumping jacks. So those are, it's not jarring to your joints, especially if you start having pain when you're performing those exercises. So that's why always go towards to low impact exercise. So you start with low impact exercise, and then when you're able to complete low impact exercise without you having pain or you compromising your form, then that's when you can go and do your high impact. So always go with, the ones that's not going to cause more problem on your joints. Okay. And then again, 2 days, twice in a week, is one of those things that is recommended. And then finally, okay. So here are your recommendations. So this is mostly for if you already have some diagnosis of, back pain, osteoporosis. So if you're already experiencing, they, you know, they identified what are the common, fractures depending on what exercise type. And you already know it, whenever you're doing a lot of forward bending. Remember, like that scale that we actually saw, like whenever you're doing forward bending, it adds more pressure on your spine. So if your muscles are not strong enough to kind of carry the load, that's when you're going to start having back pain. And then eventually the framework will give out and you're going to have a fracture. Okay. And then so if we already know our baseline, we did the fitness test, we know that we need to start, exercising, and we already know the baseline, we figured it out. So what are the red flags and when do you need to stop? So yes, you guessed it, whenever you're having severe pain, always make sure, when we talk about pain science, it's very important that you have to listen to your body. So if you know how they say, what was that adage? No pain, no gain.
No
You always
gain.
hear that,
Right.
right? We don't follow that in rehab. And the reason is because pain, somebody's laughing. Okay. You know why? Because pain is an indicator that something is wrong, right? So pain is different from soreness. If you're sore because you're exercised, then that's totally different. And again, pain is very, it's subjective. I've been studying pain science for a long time. And the only thing that can objectify pain is if I ask you, how's your pain levels today? You would still give me a number, right? But that's still, a subjective data. So everybody have that's always I always tell my patient, if my patient tells me my pain level is 10 out of 10, his pain level is 10 out of 10, right? So that's, no doubt, because everybody has their own perception of pain and we have to respect that. So try to be respectful to your body too and do not put it in a painful situation. If you have severe pain, then obviously that's when you have to seek help, right? You have to check in with your doctor, do diagnostic, and then eventually, you can always reach out to, your physical therapist or occupational therapist. Significant strength difference between the right side and the left side. You know how sometimes you're like, well, my right side is stronger because I'm right-handed, right? So that because I prefer my right side. There are right? So one of the things that you also have to look into is it says there, we didn't say the difference, right? We say significant strength difference, right? So those are the things you have to modify your exercise. Not that you should stop the exercise. It only means that you have to, get a consult, right? Seek out, healthcare providers that can help you. Okay. So the other thing that you have to do is inability, and I like this one, inability to master a hip hinge. So we've talked about hip hinge from the last workshop, right? So hip hinging is basically using your hip instead of your back. You can see me. So when you're hip hinging, you see how my back is still, you're maintaining, you're activating your core. That is your hip hinge. If you're still kind of, I don't know, LJ, if I'm doing the hip hinge properly, then like I said, take a video of how you're doing the hip hinge, because if you already have some weak core and you have weak back, then definitely not being able to do a hip hinge can cause more harm, than good. All right. And then your 5 times sit to stand. So the sit to stand, besides the 30 seconds, because there's two kinds of sit to stand. The first one is your 30 seconds where I time you for 30 seconds. I'm going to count how many times you actually did your sit to stand. While your 5 times sit to stand is you're going to do the same position, right? And then you're going to keep doing a sit to stand. If you were able to perform 5 times sit to stand for more than 11 seconds, because the goal is for you to be able to perform it in 8 seconds and less, right? If you're able to perform it more than 11 seconds, then it means, what does that mean? You have significant balance issue and strength issue. So again, that is something that you have to. It doesn't mean that you should stop and not do it again. It just so happened that you have to seek help, provide, like what's going on, why are you experiencing, all these red flags, right? So, like I said, if these are something that you would want me to help you with, I'm all for it. So just reach out to me, send me an email, and then we can probably figure out a good plan of care for you. Okay. And then some weight bearing exercises. So here, if you look, oh, sorry. If you look at the weight bearing recommendation, so this is the exact same thing we actually did a while ago, where we did your squat, single one leg standing, sit to stand, step up, and forward lunge. So you're like, LJ, I think I cannot, do all these weight bearing, exercises. So go with, like I said, after you finish your fitness test, after you have identified, like, I'm having issues. So these are for the ones that you feel like I can get started with probably just a sit to stand exercise, or even a single one leg standing with me having to support, having support. So I'm just doing strength training. So those are the things that you can actually get started with. So just identify if there are anything that you feel like you still need to work on, as long as you're not experiencing all those red flags. But if you do, then it means you probably would need something that's more tailor fit for you instead of just this overview about strength training. Okay. And then there was a question on from one of you guys, like when to add resistance or do power training. So power training has a lot to do with, because when you talk about power, you add the element of time, right? You know how sometimes they say, how many can you do sit-ups for for 1 minute, right? As many as you can for 1 minute. So that's because you have the time element that is added to to your exercise regimen. So usually they feel like, if you feel like you can perform a task for 2 sets, right? I said at least 1 set a while ago during your baseline. If you're able to perform your 10 rm for 2 sets without compromising your form, then you can add resistance. You can start performing your power training. So that's kind of like the basis. All right. And then finally, resources. So all of this information are from the training that I got from Bone Health and Osteoporosis Foundation. So they just released their annual report for 2023. So if you go to this website, you'll be able to read the latest research. So part of the research that I actually shared with you was from that report. Okay, so you're getting the most latest information. All right. And then finally, my favorite part, Q&A. So do you guys have any, and again, it's 7:46. So definitely we still have some time, but if you have to leave, because I did say like it's probably going to be between 45 to an hour, but if you do have any questions, please feel free. You can probably unmute yourself, or if you don't want, you can just ask a question on the chat. But this is the end of our workshop. Thank you so much for for joining in. So do
Thank
we
you.
have any questions on the chat?
LJ, can you hear me?
Yes.
Hi, I'm sorry. I was trying to type it in, but I was having a little difficulty.
No
I,
problem.
I did have two questions. The first one is,
Sure.
can osteoporosis lead to sarcopenia? And the other question is there a difference between sarcopenia and muscle fatigue? And can muscle fatigue lead to sarcopenia?
That is a
Hmm.
very good question. So
Damn.
usually, because so those are like overlapping
Right.
questions. So when you talk about osteoporosis, right? Osteoporosis is you're looking at a different system. So that is your skeletal system, that's your bones, right? So definitely if you have, osteoporosis, what is the cause of why you went from osteopenia, which is the weakness of the bone, to fragility of your bone, to osteoporosis? A lot of times it's because of not moving. You're not doing a lot of weight bearing exercises. You're
Okay.
basically, you have inactivity, at that point. So therefore, it goes hand in hand with so it's more like a question, which comes first, the egg or the chicken? Is it osteoporosis first, then sarcopenia? More likely in the story, right? Because it does take a lot before you can develop osteoporosis. Therefore, most likely based on the study, it's going to be sarcopenia first, then osteoporosis.
Okay.
Okay, and then fatigue. So fatigue is, that feeling of tiredness all the time. Again, you have to look into the cause and effect, right? Because sometimes fatigue can be, depending on what caused your fatigue. Did you just, overworked, the day before, and then you were just tired? Or sometimes it can be hormonal, hormonal. So sometimes it can be associated with you haven't really, how sometimes you wake up first thing in the morning and we're just already tired.
Yeah.
So it's like, wait a minute, why am I just tired? I just woke up. So there are different factors. So you always have to look into, is it really my muscle strength? Because when we talk about sarcopenia, it's about decrease of your muscle mass, ergo, you will have weakness. So, but if it's just overall fatigue or just tired all the time, then you have to look into, is it, emotional base, or is it really, musculoskeletal base? So there's always different sources of why we feel fatigue.
Got it. Thank you
But
so much.
but I have a question. The
Sure.
fatigue is also illness related or medication related often,
Yes,
correct?
that is
Or
why
are you
you
talking
always
about
have.
muscle fatigue?
Yes. So that's why, you know how when you read those fine prints, they will all say might cause fatigue and all that. So that's why I was trying to tell Miss Cece that you always have to look into cause and effect. What caused your fatigue? Did your fatigue because, you basically did more the day before and then you're just tired the next day? That can be muscle related. Or you just woke up, I'm tired. You didn't do anything, so it's not really muscle related. Or you did drink a medication and then 2 hours after you just want to go to sleep. So there's different factors why you're tired. That's why identifying, what is the cause of your fatigue can might as well, resolve how you can better address it.
Got it. Thank you.
Sure. All right, guys. And just I think I stopped sharing my screen, but let me just oh, I have it. So on our next workshop, I'm actually excited about this. The again, if you feel like there is a topic you would want me to talk about, like you want to talk about pelvic floor, you want to talk about lymphedema, circulation, it's I would probably send out a poll if you guys, wanted to share any information if you want any specific topic. But going through the workshop series for posture pelvic, we have the topic will be don't dare fall, use your core, right? So balance and core training. So that's one of the things that we're going to talk about. I'm also going to teach you. So this is a combination of, fall prevention, because, we just started fall prevention. And then we're also going to work on managing how you're going to improve your core strength, because that is very, very important. That is practically also associated with your pelvic health. So a little bit of, posture and a little bit of pelvic health combined into one. So I'm just looking forward, because those are the two things that I love to talk about. All right. So, without, if you guys don't have any questions, again, thank you so much for sharing this evening with me. I'm always, always, I was so empowered that, a lot of you guys are, learning more about how to get better. And you already made the first step by learning more about yourself. All right. Thank you. I'm looking forward
Thank
to seeing you guys again on October 28th, same time, same physical therapist. So thank you guys.
Thank you, Dr.
thank you, LJ.
LJ.
You're
Thank
Thank
you.
wonderful.
you.
Great job.
We
Thank you.
appreciate. Thank you.
Very informative.
Thank
Great
you.
Of
topic.
course. You guys take
Thanks,
care.
BK.